My name is Dr. Jo Marie Janco, and I'm a GYN oncologist, so my specialty is gynecologic oncology. I take care of women with gynecologic cancers and also complex gynecologic surgical problems. So that's obviously an area of interest for me. Of particular interest are options for fertility sparing with a diagnosis of gynecologic cancer, as well as patients who have more unusual tumors. But I really value engaging with women with any of these issues that I can help with. As a gynecologic oncologist, our specialty covers some rather unique aspects of women's health care. We do complex surgeries for gynecologic issues that may not necessarily end up being a cancer diagnosis. We also do very complex surgeries for gynecologic cancers, and that ranges from what you would expect. Hysterectomies, things like that, but also we do complicated bowel resections and surgery, and more complicated surgeries than what you would think about. We also know a lot about chemotherapy and other systemic treatments, immunotherapy for GYN cancers. So it gives us an opportunity to provide comprehensive care for women with a GYN cancer diagnosis. Gynecologic oncology is a rather unique specialty in that we are pretty expert surgical oncologists who do very complex surgeries for gynecologic cancers, but we also know holistically about the treatment of GYN cancer. And I think that positions us uniquely to really educate women and assist them with their journey in this process, and also even without a GYN cancer diagnosis for more complex gynecological surgical needs. So I think really being part of a system that emphasizes the patient as a person is really important to me. I think that we do a really great job at multidisciplinary, very human-centered care, looking at patients in the context of their families and not just their cancer, but the whole journey through their health, I think is really important. In addition, we really have an emphasis on quality and up-to-date evidence-based care, clinical trials, and exploring new options for people. So some of the technological advances that I've seen over the course of my career is more of a shift in use of minimally invasive surgery, so laparoscopic and robotic laparoscopic surgery. Also using tests like sentinel lymph node mapping that can minimize side effects that can have an impact on patients' quality of life later on in their treatment. Most rewarding part are those relationships that I have the privilege of developing with my patients and their families. It's really an honor and a privilege to be part of somebody's healthcare, and especially with the vulnerability and the emotional journey that comes with a cancer diagnosis.